Stephanie Gravner is the CEO of Medecipher, and she's going to tell us all about their solution today. There we go.
Okay. How about now? Great. Hi, everyone. I'm Stephanie Gravner. I am CEO and co-founder of Medecipher. Thank you so much for the invitation. Happy to be here and talk to you about our solution for transforming nurse scheduling and management. Nurses have played such a critical role in the pandemic, but they're burned out and leaving the profession in droves. 1 in 5 nurses has left their job since the start of the pandemic. Nurses are overworked. They're deeply worried they can't adequately care for the large number of patients they're responsible for in each shift. And furthermore, a recent Wall Street Journal cited hours and poor pay as 2 of the top contributing factors, forcing many of them to quit. Current methods for care team planning and scheduling, they're really contributing to nursing turnover. They're propagating unsafe staffing practices, leading to poor clinical outcomes, increasing risk for clinicians, increasing scheduling churn and insecurity with last-minute changes or attempts to call nurses in. And then finally, leading to needs and preferences not being met. Requests for a time off or for a certain day are simply being disregarded. So Medecipher is here to really disrupt the status quo nurse scheduling methods. And let me show you how it works. We're going to look at an application in an acute care setting. I'm going to show you the busy emergency department with a nurse manager, Jessica. So Jessica would log in. She would view the alert that today she's going to be overstaffed based on the predicted census and patient load by about 61 hours of nursing care. She would quickly scan the operations metrics, the predicted census, and notice that she's going to have mostly new nurses on staff today. This would make her hesitant about flexing all 61 nurses of nursing care. So she would use her clinical judgment, select a conservative case, make any adjustments as needed. With Medecipher, she has immediate insight into the performance impact of these changes on her metrics, like the productivity metrics shown here, which are now on track thanks to the changes that she has made in the tool. So now that we've seen the platform in action, if you will, I want to pull back the hospital exam room curtain to take a peek under the hood at the science that is powering Medecipher's workforce optimization platform. Our platform really comprises 3 distinct components: predict, prescribe, and adapt, that build off of each other, and a feedback loop that connects the 3. So first is a very robust forecasting model that is predicting the patient load. For example, the emergency department census is shown here, plus our recommended nurses per hour for that particular day. Then is a patient flow simulation model. And what this is doing is it's anticipating the performance impact of those key operational metrics, efficiency metrics, safety metrics of decisions regarding nurse staffing specifically. The forecasting engine feeds our multi-objective mathematical optimization model. This model is balancing overstaffing with understaffing, helping to reconcile cost against quality. The engine is using predetermined rules and constraints such as shift times, position control, union considerations, and adhering to all of those constraints to figure out the best combination of shifts to achieve optimal results and the best combination of nurses and human individual people to staff those shifts. The model is gently guiding the user to implement these changes. For example, adding a shift here, canceling hours at the start or the end of the shift. And then, of course, it's up to the nurse manager to use their own clinical judgment to make any adjustments. Once the changes are committed, the machine learning platform learns from those modifications that the nurse manager implemented, and that feedback is reincorporated to improve future predictions. We've proven that our solution impacts cost, quality, and most importantly, nurse satisfaction. When Medecipher was implemented at Northwestern, we saw a $300,000 reduction in overstaffing costs. These cost savings were realized by reducing overstaffing, so having too many nurses than were needed at a given time, and also reducing use of premium pay, which is agency use or use of incentive payment, such as overtime, to incentivize nurses to fill an unscheduled, or to incentivize nurses to sign up to fill an unfilled shift. We also saw that we improved their operations, enabling Northwestern Medicine to recapture unmet demand, reducing the walkout rate by 40%. So this represents patients who otherwise would have left the department without being seen, also impacting ambulance diversion, resulting in a higher admission rate and margin, driving $1.2 million in additional revenue to their system. And finally, impacting nursing satisfaction. We've reduced same-day use of cancellation, so reducing the churn in the schedule, also enabling them to justify additional nurses per shift, which is increasing the instances of safe staffing and the satisfaction coming to work every day with that confidence that you have the right number of resources and colleagues to help you out. So in total, about 1.5 in value creation and happier, more satisfied nurses. What more really could you ask for in a solution? We've rapidly grown since launching our EHR-integrated MVP at Northwestern Medicine with a beta at Wellstar and a pilot proposal to test a new use case and to offer end-to-end decision support with Queens Medical Center. We're hoping to expand by 3 to 5 sites per year. We're also expanding beyond our footholds in the emergency department market to expand use cases spanning across the entire acute care setting, from inpatient nursing, eventually outpatient nursing use cases. We've done all of this very capital efficiently, using mostly non-dilutive funding from grants, such as a recent $1 million NSF Phase 2 SBIR, and are hoping, fingers crossed, to receive funding from the American Nursing Foundation. Finally, we intend to launch an initial seed round in the spring of 2022. We have done this with the help of all of our amazing acceleration partners who have invested their time and energy in helping to vet the solution and give us opportunities to speak with physicians such as your group over here. We've won awards from the American College of Emergency Physicians and published the results of our work in really the top peer-reviewed journals, including JAMA and the Joint Commission Journal on Quality and Patient Safety. Looking into the future, we're intending to partner with some strategic partners, strategic technology partners, to really unlock additional customer channels and to reduce some of our technical debt by improving our software integrations. Our traction and success is really thanks to our team of industry veterans and thought leaders with unmatched domain expertise and extensive industry experience in best-in-class health systems. Myself, I have a background as a health system engineer focusing on operations research and patient flow. We've got amazing team members and mentors. Brian Rosenfeld, who commercialized one of the first EIC monitoring platforms with a successful exit to Philips. Darren Dunbar, who is an esteemed nurse leader who's worked at places such as Johns Hopkins, have really helped us engage with the community and expand the product to multiple applications. So thank you so much again for your time, and look forward to turning it back over to Katie for any questions.
Great. Thank you, Stephanie. You know, this platform I think is really exciting as well. One of the things that we heard loud and clear in our recent Impact Summit is the fact that I would say lots of healthcare providers, unfortunately, are leaving healthcare, but nursing turnover and nurses leaving the field, as well as, you know, what can we do to retain these great nurses? It's one of the, I think, biggest challenges for health systems right now. And clearly COVID put a large strain on that as well. So this is exciting. I'm excited to hear more about this future study that you talked about, looking at impact on nurse turnover. Can you talk more about that?
Yeah, thank you. So let me pull up. So we are, so we're proposing a new case study with Queens to really look at turnover, specifically to understand whether or not more satisfaction around the scheduling processes leads to improved retention. So what we're focusing on is increasing, really kind of changing the application from just flexing to really study the planning and the assignment modules. So working on having an improved schedule up front, seeing how that can really benefit downstream. One of the things that we're really excited to be able to measure is turnover, retention, engagement. So hoping that we can partner with additional technology vendors. One is called Laudio, that is an EHR-integrated satisfaction tool that helps sort of in real time capture engagement, burnout, fatigue, et cetera, such that we don't have to wait for really sort of latent indicators such as an engagement survey or turnover stat that really only come up sort of once a year, so that we can really get ahead of this and see sort of in real time in a short pilot proposal what the impact on retention, engagement, turnover, and satisfaction are.
Great. I think that'll be really exciting to see for sure. You also mentioned, I think in your timeline, you just had it up there. I'm like, I want to know more about this end-to-end decision support that you're talking about implementing. Talk more about that aspect.
Yeah, I think there's really a true lack of integrated decision support for the entire scheduling horizon. From when budgets are created, that's really a year in advance. There's companies such as, Vizient, Truven Analytics that provide some benchmarking, but it's essentially what everybody else is doing. So you might say, we want to be top decile in terms of our performance. Let's look at who's in the top decile for our peer group in Vizient, and we'll benchmark against that. But that doesn't really help you think about how to do this sort of better and more intuitively. Again, when the medium-term horizon is being considered, these are routine. Every month, you're creating a schedule, you're creating the assignments, and there's, again, a lack of decision support for those routine activities. Most institutions for nurse staffing are using some combination of Excel or Google Sheets to create the scheduling grid. And then they're gathering requests from the legacy ERP system, whether it's a Kronos or an API, or it's emails, pencil and paper, and reconciling those preferences and requests. And then a nurse manager is really doing this manually by hand, mapping people into a particular slot. And so you can understand how this is super frustrating. And a lot of times a human is sort of not able to meet the needs of all of the staff that put in the request. And then finally, when it comes to short-term decision support, we see, there's dashboards available in Epic and Cerner that provide perhaps like what's going to happen in the next 4 hours in terms of the census or expected volume increases, but it doesn't really tell you what to do with that information in the context of changing your staffing decisions. So what we're really aiming to do is provide this end-to-end decision support that spans when the budgets are created to when the schedules are created to when the schedules are adjusted, and be that one-stop shop for nurse managers to use our platform to really inform and support the entire decision horizon.
That's fantastic. I want to move on to a few questions from our audience here. One of our audience members, love what you've done, and I believe that nurse scheduling is a real issue. However, isn't there already burnout due to the burden placed on staff to log into not only the EHR, but as you mentioned, they're usually going into Kronos and several other systems. Does this add Have you found with your current partners that is a barrier, that they have to log into yet another system, use another tool?
So simple answer, this is a tool for the nurse manager or the nurse scheduler. So it's really only perhaps 3 or 4 people tops in a single department using this tool. The tool is not meant to be a tool that the bedside end user uses necessarily. So we're really limiting it to the people who are currently doing the schedule, currently spending 20 hours every month on this. And we're essentially disrupting their Google Sheets and handwritten sort of note workflow.
All right. And I think I can actually answer this question. But yes, current state is only in the emergency department for staffing, correct? And you're looking at moving into some of those other areas.
Yeah, and that's the proposal that we've submitted with the American Nursing Foundation, is really to sort of expand the use cases following the patient flow pathway through the hospital to inpatient med surge. So essentially we're asking for funding to transform the emergency department footholds use case to those expanded application areas.
And lastly, and I think you mentioned this maybe as Paul was submitting this question, I think you may have answered it, but how are you quantifying burnout? What are the exact points that nurses would say this needs to be improved in order to not leave, right?
Yeah.
In order to retain, and how are you quantifying those things?
Yeah. So here, actually, so there, I don't know if this is on this slide. Maybe it's not. So, for example, the employee engagement survey typically has a question around, do I have the necessary resources to do my job? So there are specific questions for each organization pertaining to the scheduling process. Laudio, which is a technology partner with us, they have their own metric that's proprietary to them that measures burnout. We're not trying to reinvent the wheel by creating a new metric. We want to partner with them to be able to use their existing metric and get those results.
Fantastic. Well, Stephanie, thank you again for being here with us tonight. It's very exciting to hear about this platform, and I'm sure we're going to hear much more from you in the future. So that is very exciting.